Major headline this Friday night, the deadly coronavirus soaring in numbers tonight. A new case here in the U.S. The CDC now confirming a second case, a woman in Chicago. In fact, 63 patients are now being tested here in the U.S. for possible symptoms across 22 states. And alarming new video tonight from China showing patients crowded into the Wuhan Red Cross Hospital. The staff in hazmat suits. Tonight, China reporting dozens of deaths.
So what makes this one different from the others?
Yeah, so coronavirus is a family of viruses, and some of them actually just cause simple stuffy nose, that kind of thing. It's because of the way it's built. So think of it like a tennis ball, and the coronavirus has these spikes that come out. Those spikes allow it to attach to certain cells. So if it only is allowed to attach to the nose cells, those spikes, then it's cold. However, if the spikes allow it to connect to your lung cells, now that can go down and it can cause the pneumonia and shortness of breath. So the way that coronaviruses work, all viruses, they need our machinery to make copies of itself. They're trying to borrow our factory. So when they attach to the cells in the lung, what they do is they then inject their blueprints, and it says, the factory, please make all of these viruses for me. So as the viruses are being made in your own cells, it becomes too many, and then it explodes, and then it kills your cell, and then go and infect other cells, and then I can cough it out. So that's why when we take a picture with somebody with the Wuhan virus or the SARS virus, which can connect in the lung, all of a sudden you see this fuzzy white stuff in the lung, and the lung is being damaged. So one of the key symptoms that we're seeing is that people get very short of breath, they're not able to breathe, and that's why they end up in hospital.
The embassy in China is evacuating American citizens from Wuhan, the center of the coronavirus outbreak. More than 1,500 cases are now reported in China, where at least 54 people have died. Here in the U.S., 63 patients have been tested in 22 states.
In Hong Kong, 5 confirmed cases led the city's leader, Carrie Lam, to confirm a state of emergency on Saturday and said flights and high-speed rail trips between the city and Wuhan will be halted.
What treatment options are there?
So there's no treatment options, unfortunately. So we don't have a direct treatment against the coronavirus. So it's all supportive therapy. So that's why they quarantine the people, they get them into hospital, and it's supportive, meaning they can't breathe, we give them oxygen, they can't drink, we give them fluids, their kidneys shut down, we help them. And really what we're doing is we're waiting for the body's own immune system to fight it off. So basically what happens, your army, your immune system comes and fights with whatever it has. Very quickly it says, I need to build a special weapon. We call those antibodies. So basically the antibodies can recognize those spikes. So the antibody grabs a hold of the spikes and then it gets rid of the virus. So that's why 3-4 days later, people start getting better from a normal cold, because the antibodies have been made. Unfortunately, with SARS, it was so fast that it killed people before you can. So that's why it was a bit lethal. And here we're seeing some similarities in that situation. Also, the elderly, their immune system is not so good. So therefore, they might not make it, and then make those antibodies. And then finally, these things came across from an animal. So it's quite new. So our immune system, they don't recognize it, and that causes further delay.
Government health officials tonight say that without a doubt, more Americans will be diagnosed with this deadly virus in the coming days. The latest confirmed case here is a woman in her 60s from Chicago. She returned from China last week and felt sick 3 days later.
She has limited close contacts, all of whom are currently well and who will be monitored closely for symptoms.
Another American patient in Seattle who was hospitalized in a biocontainment unit could be released in a few days.
3 Australians have been diagnosed with the coronavirus infection, bringing the national number to 4, and authorities are expecting that number to rise. There are 3 confirmed cases in New South Wales, with 1 other case found in Melbourne yesterday.
The CDC is now running tests on 63 sick patients from 22 states, including 1 at Texas A&M in College Station. Health officials are going to be terribly busy at these 5 U.S. airports when flights from the affected regions in China resume. Already, they've screened more than 2,000 travelers. This is a scene from the Seattle International Airport. Passengers tell us the gift shops ran out of face masks early this morning.
Our focus right now is on travelers returning from Wuhan, but the situation is changing rapidly, and we're continuing to assess, and we'll make new guidance if needed.
Well, David, health officials here at the CDC say they're approaching this as a serious threat to public health, but at the same time, they say based on the information they have in front of them at this point, they believe that the general risk to the American public is low.
How worried do I need to be? So again, I think information will continue to develop as we get more, more information, I guess, data from what's happening in Wuhan. But let's just keep this in perspective. This is not something that so far we've seen is transmitting very, very easily from person to person. So,
you have to be very close, they said.
Exactly.
Okay.
Close enough. So, these are viruses that tend to travel in large droplets that are generated when you cough or sneeze, and if you're infected with the virus, and especially when you're really sick from the virus. And so those large droplets really don't travel very far. They go maybe 2 meters away. So if you're just sharing a room with somebody who may have this infection, your risk is still it's low. It's that kind of contact that you need in order to get infected.
Okay. But about that press conference, I wondered what you interpreted by the fact that it was so well organized. What is the statement, do you think, these health officials are trying to make by having 6 or 7 of them sitting together? It's well organized. Why not just put out a press release and say, hey, it's confirmed, we're watching it?
Oh, I think we've learned a lot from the past,
Diana Adama, an American, documenting the ordeal on Facebook.
And I have a little bit of fruit. I have no vegetables. Am I confident about China and the authorities here to be able to contain this? No, it has not been contained to begin with.
You mentioned SARS in your last question. Let's make a distinction here. What makes this coronavirus different from what we saw in SARS? Because certainly in the early days, that was the comparison, a SARS-like coronavirus coming out of China.
So it's in the same family, so it's a coronavirus family, and corona just means crown. So when you look at these viruses, they all have these little spikes going across the top. So the differences are the spikes and how easy is it to transmit and how deadly is it. In other words, how fast does it grow, and therefore how fast does it destroy your lung cells. So therefore transmissibility is what we're looking for. Now in this particular case, it's a unique feature. So when they found the virus, they sort of did the DNA or the RNA coding, so they know the mapping, and it looks different than SARS. So that's why they say it's a new virus that's coming out. Again, because our body won't be able to recognize it. So now they're saying, how many people does it kill? But that needs to know the bottom number, like how many people are infected. So right now they're saying, let's say 1,300 people confirmed. That means that they had the test, they were sick enough to come into hospital. But you can imagine there are many people that may not have gone to hospital that have sickness, they're at home. So we don't know what the bottom number is. We know that 41 people died, but then we don't know how lethal it is at the current moment. And we don't know how fast it transmits to people because we can't track every single person that is sitting there in Wuhan.
Yes.
I've heard that certain Chinese citizens are saying that the government are misreporting the actual cases, how many cases there really are. So I guess I would ask a doctor how much can you trust the data that's coming out?
What would you say to that?
That's a good question, and that's what happened in SARS, 20 years ago. Basically, it was information that wasn't shared. Now, initially, the World Health Organization is saying that China has been sharing, which is true, because right away, we've now got the gene of this thing. We've mapped the whole thing out, which means that they identified it and they talked about it. In terms of the numbers, part of it may be that they don't want to report the information. Part of it also might be the information is changing so quickly. As you and I have looked at, one day it's 8 people, the next day it's 17, the next day it's 41. You keep turning around, and the number of deaths are quite high. And they're also running out of supplies. In other words, that special fast test to check for this virus, they're running out. So if they don't have it, they can't label that person as having the virus. However, there are reports sort of on social media that I can't confirm, but doctors are saying there's huge lineups at the hospital. They're running out of supplies, masks and things like that, because if you lock down a city, your transportation system, you can't bring in all the goods as well. So therefore, the next sort of crisis that we have to manage will be what happens during these lockdowns in these cities. Are we going to get the medicines that we need, the masks and all those other things to the right places? And can we take care of these people? And that's why when I heard that they're building 2 hospitals that are 1,300 people, it means that the problem is quite big. So for example, initially we kept saying it was a couple of hundred people. Yeah. If it's a couple of hundred people, I don't need to build a new hospital. I could absorb that. But the fact that they're building 2 complete hospitals there means that the numbers are very large on the ground. So we may be missing some of the people. And for sure, there are sick enough to go into hospital that have the virus that may be now spreading this virus further out.
Search social media these days and you'll find plenty of this. Unverified video showing people in China apparently falling to the ground, stricken with the coronavirus.
So you could guess everybody got infected.
There's no evidence to back up those claims, nor to confirm other unfounded information shared widely, like the assertion that the virus can be thwarted with nicotine, or that a vaccine was patented 5 years ago. The stream of misinformation leading public health officials to make this plea.
To rely on evidence-informed, credible sources of information when you're looking for updates.
Online rumors can have real-world consequences, like on this flight that just landed from China. A Toronto woman's post about returning home from Wuhan got shared and morphed into the false accusation she had escaped and should be quarantined. Pearson Airport even promising to share this information with Canada's Immigration Department. But as the flight arrived, the woman wasn't there. Her husband telling us she delayed her return for her own safety, fearing a social media mob.
The internet disseminates nervousness very well. It takes unverified information and spreads it around the world faster than it can be corrected or put into context.
This flood of falsehoods fueled by a lack of understanding of the virus itself. At UBC, Alfred Hermida is tracking the ever-growing chatter. He spotted 24,000 tweets on Monday.
So far today, it's nearing 500,000.
He says they're not all bad, though.
What my analysis shows is that some of the most shared messages are around how to stay safe, how to avoid infection.
When something unverified can raise fear for no reason, it's best to check the source before sharing.
Tonight, dozens of people are dead after a powerful earthquake rocked Turkey. The magnitude 6.8 quake struck last night in eastern Elazig province. More than 1,000 people were injured. Many others are feared trapped. Here's Imtiaz Tayeb.
In the immediate aftermath of the quake, panic and confusion as first responders rushed to the scene, saving whoever they could. By sunrise, the scale of the disaster was clear. Neighborhoods devastated, homes flattened by the sheer force of the quake. Rescue teams worked in near freezing temperatures, saving, among others, this heavily pregnant woman, crying out in relief. Turkish President Recep Tayyip Erdogan rushed to the area to speak to survivors, but he came with a warning, telling them not to repeat what he called negative hearsay about the country not being prepared for earthquakes. Whatever the case, rescue workers continue to do whatever they can. This one was able to reach a woman trapped under the rubble by calling her cell phone, telling her not to fall asleep. A short while later, and the woman was saved. But now it's a race against time to save those that remain buried under collapsed buildings.